Communicating confidence, from empathy to action. As community health workers, people trust us to help them stay well and to provide accurate and up-to-date health information. What we communicate and how we communicate with our clients can have a strong influence on the decisions they make about their health. This is especially true when speaking to people about getting vaccinated. You play a big role through the way you communicate in increasing people's willingness to vaccinate themselves or their family members. This video guides you on how to have empathetic conversations about vaccination that acknowledge the values or beliefs of others. We will take you through a step-by-step process of how to talk to your clients to promote vaccine confidence and vaccination. We will cover listening, addressing concerns, sharing factual information, checking for understanding, and empowering action. We will also discuss how to identify if a person is ready to change their behaviors and how to tailor your conversation to meet their current needs. Part 1. How to have a conversation to promote vaccine confidence. There are many reasons why people may be hesitant to get vaccinated. We have explored a few of them in other videos, and these can include misinformation, myths, values or beliefs, culture, bad experiences with healthcare professionals, or even a lack of information. When discussing vaccination and people's reasons for not wanting to get vaccinated, what you say and how you say it can affect a client's vaccine confidence. Your community sees you as a health expert, so what you say should be accurate and current. You should also be open about what we don't yet know. Prepare a few simple facts to tell your clients that are easy to understand and remember. Try not to get too technical. One effective way to share information is through your own stories and experiences. You can personalize the information based on your client's needs. The how follows a 6-step process that gives structure to conversations and combines factual information and empathy for your client. Being empathetic means identifying, understanding, and sharing your client's thoughts and feelings. It helps you connect with them, convey support, and build a positive relationship. Step 1 is introducing vaccination. How you talk about vaccination can affect your client's willingness to vaccinate. Instead of asking, "Do you want to be vaccinated?" rather say, "We know that vaccination is important for our patients. Let's discuss a plan for you to receive your vaccination." Although these seem similar, the second one implies that vaccination will occur and that it is expected. In step 2, you listen to your client's concerns. Help your client to feel comfortable so that they share their thoughts and feelings openly. Listen respectfully and check that you correctly understand what they are saying. While you may not always agree with their concerns, it is important to provide empathetic listening. Once a person feels heard and understood, they are more likely to be receptive to your advice. In step 3, You address their concerns. See if you can identify and connect with an underlying belief that gives rise to their concern. This critical step builds trust and helps you find common ground with your client, leading to an open conversation. Be careful not to reinforce a myth unintentionally. Step 4 focuses on the disease. Provide facts about the disease, its severity, and your client's risks before discussing the benefits of the vaccine. Now is a good time to share your own stories. Step 5 empowers your client to act. Openly discuss the risks and benefits of the vaccine that are specific to your client. Contextualize these risks and benefits while also dispelling any myths that may cause their hesitancy. Describe how vaccination is their best choice to protect themselves and others against severe illness. This provides them with a solution and a clear way to reduce their risk. In step 6, you keep the communication going. Even if your client still decides not to be vaccinated, your open and honest conversation with them has shown how much you care about their well-being. Tell them that you will discuss vaccination again in the next visit because it is important to them. The more you use this process, the easier and more natural it will become. Part 2. An example of a conversation to promote vaccine confidence. This is an example of a recent conversation I had with a client. At the end of our session, I introduced the COVID-19 vaccination. Take a look at what happened and how I used the 6 conversation steps to build his vaccine confidence. Before you go, let's plan your COVID-19 vaccination. Can you see that this statement implies that vaccination is expected and presumes that my client is ready? Remember that the client always has the final choice of whether to get vaccinated or not.
Oh no, I won't have that vaccination. I've heard about people getting COVID straight after being vaccinated. My neighbor couldn't get out of bed for 2 days after he got his vaccination. I'll lose my job if I get sick and can't go to work.
It's time to acknowledge my client's concerns. Listen to him and make him feel heard. It sounds like you are worried about the vaccine causing the disease as well as the side effects. A way to help your client feel understood is to repeat what they have said in your own words. Ask questions, be open to their responses, and imagine yourself in their situation. Don't dismiss their concerns. It is normal to have worries like this, just like they would for any other treatment. Thank you for sharing your worries with me. Can I share my knowledge with you about how the COVID-19 vaccine works and its side effects? This is a way to keep the conversation going. If the client says no, you can suggest a conversation about it again in the future. You can also explore why the person doesn't want to talk about it, with the goal being to understand, not to change their mind.
Okay, but I still want to be vaccinated.
I can understand that you do not want to get sick or lose your job, and that you have concerns about the vaccine. My job as a community health worker is to help you stay healthy. I want to assure you that this vaccine does not contain the live virus, so it cannot give you COVID-19. You can have mild side effects after the vaccination, similar to other vaccines like the one for flu. You can treat them at home, and they usually go away after a few days. They're also a good sign, as it shows that your immune system is learning to fight the virus in the future. My sister was also worried about the side effects after being vaccinated. She planned ahead and got her vaccine on a Friday so that she could rest on Saturday if she didn't feel well. She successfully got her vaccine, and in the end, she didn't even need to stay in bed as she felt fine. Does this help your understanding of the vaccine, how it works, and its side effects? In this situation, I identified my client's need to stay healthy and protect himself and his income. I did not repeat the misinformation, but just clearly stated the facts and provided high quality and reliable information. Focus on keeping it simple and clear, and check that the person understands. You can also share your own stories and personal experiences.
Yes, but I support my parents at home and my 3 brothers and sisters. If I'm not well, they will have no one to provide for them.
I admire you for caring so much about your family and wanting to make the best choices for them. COVID-19 is a serious disease and can even lead to death. Many people can have life-threatening complications like heart attacks and blood clots. One can also develop long-term complications from the disease like heart disease and neurological problems. Focus on the disease and not vaccination, and avoid intimidating or scaring your client.
I do not want to get COVID-19. I wear a mask and wash my hands. That should protect me, shouldn't it?
I'm glad to hear that you are doing those things. All of them are important steps to take. Still, the single best way to prevent yourself from getting severely ill is to have the COVID-19 vaccination. This will also make sure that you do not pass the virus on to your family and friends. I was also very worried about getting COVID-19, as I spend a lot of time with people, some of whom are not well. I chose to have my vaccination to protect myself, my patients, and also my family. I recommend vaccination to everyone I care about. Ensure that your clients know that the vaccine is a tool they have to protect their health. Provide details that highlight access to the vaccine and its benefits.
You've told me a lot today. Let me think about it, and maybe we can talk about this again next time.
Although my client has not chosen to be vaccinated now, he is open to discussing it, which is a positive outcome. At the end of our discussion, I also gave him some information from a few trusted sources to read at home. Keep in mind that these conversations may take time and can continue over many visits, depending on your client and their concerns. Part 3. Identifying how ready your client is to vaccinate. The clients we meet with may be ready to take action, or they may not be, or anywhere along the spectrum between those two. By identifying where they are, you are better able to address their current needs instead of pushing them towards vaccination when they may not be ready. A tool we can use to help understand how ready our clients are is called the Stages of Change model. It illustrates the 5 stages of change a person may move through when making a decision in behavior related to health. Let's explore these stages together. The first stage is pre-contemplation. As contemplation means thinking about something deeply, this is the stage before your client starts considering vaccination. In other words, your client does not intend to act for at least 6 months and may not even accept that getting sick is a serious concern. So, they have chosen not to be vaccinated. They could move into the contemplation stage. Here, your client has decided to change their behavior in the next 6 months. In this stage, they are considering the advantages and disadvantages of being vaccinated and may feel uncertain or indecisive. If they have decided to act within the next month, they are in the preparation stage. They have a plan of how and when to get vaccinated. The action stage is changing their behavior. In this case, it means being vaccinated. The maintenance stage is the last stage where they are working to continue the changes. This means that they are still taking active steps to prevent getting sick or infecting others. It is important to know that one stage may not come directly after another in order, and a person can move through the stages many times. As a community health worker, your job is to help each client move through the stages of change. How? Firstly, by understanding the different stages. Then, by assessing your client's level of readiness at each visit, recognizing that this will change over time. Finally, by identifying which stage your client is in and using strategies to support them in moving closer to action and maintenance. Here are a few techniques that I often use. If a client is in the pre-contemplation stage, be empathetic, ask questions, listen intently, and do not push them into action. Your goal is to get your client to become open to thinking about change. Another video gives an example conversation to illustrate how I explore my client's thoughts and feelings without pressuring him to do anything. If your client is in the contemplation stage, again, be empathetic, build your relationship with them, and prompt your client to think about their risks. They should start considering the advantages versus disadvantages of being vaccinated. If they are in the preparation stage, encourage them to commit to vaccinating and offer to help with their plan. We will cover more about how to support those ready to vaccinate in another video. Remember to support your clients through the vaccination process and as they continue their prevention strategies into the future. So, what can you do? By combining your knowledge about disease and vaccination, as well as your skills to have empathetic conversations, you are in the best position to encourage people to get vaccinated. When discussing vaccination with your community, you can equip yourself with correct and up-to-date information to share with them. Refer to the videos on misinformation and how to source trusted information for guidelines on how to tell facts from fiction and recognize reliable and accurate information. Follow the 6-step conversation process. Focus on respectfully accepting people's beliefs, asking questions to understand their thoughts and feelings, and having open and empathetic discussions about vaccination. Try to persuade them to vaccinate, but always respect their choices, and never argue or force them into anything. Identify your client's level of readiness for changing their behavior at each visit. By using the stages of change model, you can tailor your approach and communication to help them move towards action and vaccination.